You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible.
All right, Colleen, let's still talk about this here. So when we look at what's been happening around the country, we were promised, massive testing in parking lots and Walmart and Walgreens and all these things. And we had Dr. Nunez Smith, who co-chairs the Biden COVID task force, who said that we still are not where we need to be when it comes to COVID testing in this country. As someone who owns a facility, just your thoughts on where we stand when it comes to COVID testing.
We are, Roland, we are so far behind on testing. And now I think part of the issue is that we are seeing what we call COVID fatigue, which means that a lot of people believe that COVID is not as severe or as frightening as it was. So therefore, we're not being tested. And the ratio of asymptomatic people are even greater. So we look at our drive-through and our sites that we do on a daily basis and realize that we're not touching half of the population that we should be touching. That's a huge issue still continuing in this country today.
And obviously, African Americans are impacted, and we don't have a lot of African Americans who are leading places where they actually do COVID testing. So talk about that. What it has been for you and your company in this space.
So being on the ground as being one of the largest African-American facilities in the country and being on the ground from day one, we were on the task force for Dr. Briggs because we had the technology. We've been all over this country testing. And the greatest disproportion that we see is African-Americans. I can look at our lines and I can stand up and I can say as a laboratory owner who is of African-American descent, I know that African-Americans are not coming to our sites. They're not being tested. And what we've attempted to do is we've attempted to be in the spaces. We've attempted to go to the churches, locations in the underserved areas to support. And it's getting out that word that we still need to be tested. I mean, we cannot emphasize that enough in this country for people of color.
When you talk about getting that information out, I mean, I was texting Dr. Ebony Hilton, and I was sharing with her what we have been seeing, where you've had these folks giving out even the vaccines and places where the predominantly African American and largely whites in the lines. And she said, I don't believe that this is really about folks not wanting to take the vaccine. She said, but even having the information on where it's actually happening. Same thing when it comes to testing. Do you think it's because we just simply did not do a major information effort? And so we had Donald Trump and his folks leading this whole thing and just, don't wear a mask or downplaying it, that it just simply caused so many people not to focus on it and did not truly marshal the federal resources to make this a national emergency.
Oh, absolutely. This started from the top. This could have been so much better ran from the administration standpoint. And when you look at all of the states scrambling for a unity plan, we don't have it. None of the school systems can open up correctly just because the head of the country didn't give us a plan. This was easy. This could have all been avoided had we had the correct information from the top. So now what you have is every single state trying to devise its own plan, school systems trying to devise a plan with no direction, no guidance from the White House. So a lot of what we've seen and have gone through could have 100% been avoided had we had direction and we had guidance. And we explained to the population that this was much more serious than what we're seeing now. And today, I don't think that there's anyone in this country that is untouched by death or loss with COVID. It is just, and now we're so immune to people dying of COVID, that it is happening so fast that we don't even get to react. We just go, oh, there's no sadness to this. And we're losing people at an alarming rate. It is incredible that we're still facing this. And now we're losing more people. I think it took us maybe months for me to personally see someone die in my own personal family. But now those deaths are coming more rapidly to most people. And what we see here in our laboratory, same thing. We're testing people over and over, and you come in one day and we test you, and 2 days later you're coming back, and the next day you're in ICU. So it's very, very critical. It's very critical. I cannot express how critical this is to continue to get us tested. But I also want to express that it is not so much as to get us continually tested as we need to be in the conversation for the vaccine. That is the most important thing that I can express here today.
And when you talk about being a Black laboratory, the reality is having that connection with the community is also important, because for African Americans it also comes down to trust. And that frankly hasn't been easy, as y'all have had to contend, because look, we're dealing with big business. We're dealing with companies that this is a multi-billion-dollar industry. When you talk about PPE, when you start talking about masks, when you start talking about testing and vaccines, we're talking billions of dollars, and there are very few African Americans who are involved.
Absolutely. So if you notice that when all of this first started, the big companies, they've gone after everybody else, and they initially, some of the larger laboratories were sending 5,000 and 10,000 kits to some of our underserved inner city communities. But the problem was they were just throwing money and throwing kits that the government was paying for, but unfortunately they didn't have anyone that would go to our communities and provide that service. So MCI Diagnostics, we took foot. We saw it. We were on the ground in Atlanta for almost 60 days straight. We, of course, are based in Dallas, Texas. So we've supported our communities here. But the biggest thing is that we don't have enough people. And the big laboratories, now they're throwing testing to our communities. But see, when we needed you most, you didn't come. And now that the money is kind of like at the end of it, now they're getting with our leaders, our African-American leaders, and saying, we want to come and test the community. But the issue becomes, you needed to test us when you were testing everyone else. And so what I have been fortunate enough to do in our community here is that I've been fortunate enough to teach a number of African-American churches how to self-collect with their ministries and be able to send those tests back to us, so that we can test, so that we can get African-American churches back open. Because I think that the biggest support for us in saving us at this moment is to have our church leaders advise us, testing, the vaccine. Those are things that are most important in this season for us.
What, obviously, this new administration, from your vantage point, have you seen a change, if you will? Have you seen in the last 3 weeks a really change in how things have been going when it comes to dealing with COVID?
Honestly, I would like to say that we have a lot of conversations around COVID. We have a lot of conversations around the vaccine. But unfortunately, we still don't have the vaccine in any underserved area, most of our underserved areas. We do not have enough people of color administering those vaccines. And I can tell you from our own perspective that the roadblocks that are put into being a provider, 99% of healthcare professionals that are of African-American descent will never be a provider to carry the vaccine, from HL7 interfaces to being connected to the health departments, to data loggers, to storage. Those are all obstacles that 100% we face. And so even though the African-American community can support the African-American community, they have made it so difficult for you to qualify as a provider. So I'm a provider, but we're still fighting in the state of Texas and Oklahoma to get the vaccine. We are very fortunate. We have a laboratory in Atlanta that we are being able to provide services there, but they've made it so difficult for people of color that do not own a laboratory, and most of us do not, to hold and carry the vaccine. Refrigeration, certificates of compliance for the refrigeration. No one has that. So how do we support our communities? How do we reach that level of population? It's going to be very difficult for us to do that. We're one laboratory and we're trying to support as many as we can, but then you have to give us the vaccine because people of color trust people of color. I look like you, my mother looks like you, my sisters look like you, and I can show up and say that what we're going to do is going to benefit you. And then we've done a lot of testing ourselves to look at the vaccine. I personally have had the vaccine. I've had my first and second injection as a healthcare professional. And so I was able to do a test on me after I got the first vaccine to make sure that I could have this conversation. We were not given the vaccine. I can test that. And I, too, now have antibodies that are growing. I do believe in herd immunity, which means that we've been on the ground collecting for almost a year. And a great 90% of my staff has never had COVID. So we've been exposed. But I also wanted to be able to have the conversation to say that I took the vaccine. I took first and second. I tested me each and every time after the first injection to look to see if I actually had COVID or if I was injected, so that I could say to the people of color, we are not being injected with COVID. And then the biggest thing is in this season is once you have the vaccine, you want to make sure that we have antibodies growing inside the body, that it gives us that level of protection with the vaccine, Pfizer or Moderna.
So when you say you believe in herd immunity, your folks have been exposed, did they have it? So when you say exposed, what does that mean?
So a lot of times when people have been in the house for an extended period of time because everyone was kind of afraid to come out, we've been on the ground since day one. We've been exposed. We've contacted. We've collected in multiple states. We've collected around the nation. MCI has been in D.C., Maryland, Atlanta, Georgia, Houston, North Carolina, Florida. So we've been in a lot of places, and herd immunity grows when you have that exposure. And we've had no one on my team except for 2 people out of the families and the lives that we cover that have ever had COVID. And one of them was because someone went to Branson, Missouri. So herd immunity is being exposed and it's sort of like having the flu. Sometimes you're around people that have the flu, but you never get it. And that's what this country is trying to attempt to do is by getting so many people vaccinated that we start developing herd immunity. I could say that I got tired. I've seen a lot with this virus, too much. Things that no one person should ever see, we have seen. So, it got really scary. I was one of those people early on that said that I didn't think that I wanted the vaccine. A lot of healthcare professionals are saying that, but you have to take it because otherwise we are. It's a form of genocide for African Americans and people of color if we do not stand in those lines to take the vaccine.
All right, that's it for us. I appreciate it. Thanks a lot.
Thank you.
All right, folks, back to our Roland Martin Unfiltered video in just one moment.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have, you can bring to Roland Martin Unfiltered to support it. Please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.